Hello friends, I'm Dr. Biren Nadkarni. I'm consultant orthopedic and joint replacement surgeon. I'm practicing at Holy Family Hospital and Sitaram Bhartiya Institute in New Delhi. In this video, we are going to talk about post-COVID avascular necrosis of femoral head. In the recent few months, we have seen a resurgence of a problem called avascular necrosis of femoral head, which is basically the loss of blood supply of the femoral head. We know that the hip joint is made from the socket and the ball. A ball is basically formed by the thigh bone, upper part of which is like a sphere, and it rotates in the socket of the hip bone. When the blood supply of this sphere reduces, it can lead to something called a collapse, and it can lead to ultimately degenerative condition of the hip, secondary osteoarthritis of the hip. So what is post-COVID AVN? So AVN as a whole has been seen to be very commonly caused before because of intake of steroids or intake of alcohol, and there are some other rare conditions also which cause this problem of AVN. So we know that during the COVID pandemic, a lot of steroids were used for patients having pulmonary complications and other problems of COVID, for which steroids were used, and that was important at that time. But the effect of that sometimes haunts this hip joint, and this is what we are seeing in the daily practice. So can AVN of the hip be treated without surgery? Yes, it can be. If you catch the problem in very early stages, MRI shows the arc, which is when the involvement is less and the patient is motivated to take some rest. There are treatments available where we can delay and you can actually help the bone heal. So it follows a whole process. It takes about 6 months to a year. But there are some drugs called bisphosphonates, which is also used in treatment of osteoporosis. They have been shown to be useful in the management of osteoarthritis, of avascular necrosis of the femoral head. So this is the mainstay, and most of us have been using this drug for treatment of early stages of AVN, where the sphericity or the ball-like shape of the head of the femur is maintained. Coming lastly to what are the other procedures or what are the surgeries which we can consider for problem like avascular necrosis of femoral head? The first and foremost surgery which has been done for very early stages of AVN of the femoral head is core decompression. Core decompression, as we can see in this model, involves putting a small hole, and this is how the cross section looks. If this is the portion of the femoral head which is involved by the AVN, you want to reach this area. And how do you reach it? You basically make a core and try to reach all the way to that area, try to decompress it, and by doing this you are actually adding more vascular channels. You're allowing the fresh blood flow to go into that region. In addition to this, we can add bone graft, which can be procured from patient's own body, and it can also help in helping recovery of the died cells which are there in the femoral head. Other than that, if the problem has gone to a stage where core decompression, the results are not known and the stage is much ahead, like after the collapse of the ball or of the femoral head, then procedures like core decompression, the results are very poor. These are the patients basically who will benefit by a hip replacement, and hip replacement has guaranteed good successful outcome for these patients. I hope you have been able to get adequate information about avascular necrosis of femoral head. Post-COVID, yes, it is of course a thing which we are seeing more often, but it has been there before also. And I would request you to share this video, like this video, and if you have any queries or questions, please do ask us. Thank you.